We've all been touched by cancer, either ourselves or someone we love. And the statistics say that 1 in 2 people will receive a cancer diagnosis in their lifetime now. And it's scary. But my guest today gives us hope and a message that it doesn't have to be that scary. I think you're really going to enjoy this conversation with Dr. Nasha Winters. She's an integrative oncologist. She's the author of the book, A Metabolic Approach to Cancer. And she talks about many things in this conversation and the 3 key things that helped her reverse her stage 4 cancer diagnosis at age 19. The third will really surprise you. And we talk about the emotional connections and the commonalities between personality adaptations with people with chronic pain and cancer, very similar. And I think it's all a message that our body is actually looking for our help. I hope you enjoy this conversation and don't forget to share it with someone who really needs to hear it. I'll see you inside. Dr. Nasha Winters, I am so happy to have you on Wellness by Design today. Welcome.
It's so wild. How long have we been trying to do this?
Oh, it's been a good few months.
Yeah. Yeah. And I mean, the moment we met in some very light, superficial places, but when we really connected last fall, I don't know, there's such resonance here. I'm really excited to see where this conversation is going to go with you and your community today. So thanks for having me.
Me too. I'm excited because I think we have a very similar message. You help people with cancer through empowerment. And I have to do the same thing with people with chronic pain. And actually, I have people with chronic pain who have cancer because I think a lot of the foundational root causes are probably similar. So we can talk about that. But let's first talk about what took you into this work, because you're an oncologist. Most oncologists are doing the traditional thing. You're not doing that, the conventional thing. You're doing something a little bit different. So what took you, Nasha, to going this different route?
Sure. Golly, I think that no one ever chooses to get into whatever profession we choose to get in the medical field, at least, without it having kind of a pain to purpose
Mm-hmm.
or some very personal experience with your own healing or disease process or someone very near and dear to you. So my story doesn't differ, probably from yours or many of the other guests that you have. But for me, it's interesting that your specialty is chronic pain because I had a lot of chronic pain issues as a baby. I had extreme digestive pain, like big bloaty belly that they put me on what was sort of equivalent to baby Prilosec. It would take years for them to figure out I had celiac disease and dairy allergy, like all the things that, of course, we didn't think that diet had anything to do with it. We just kept putting a pill into a little person in the 1970s. And then by the time I started my period, I had such extreme pain. I was diagnosed with endometriosis and I spent, 3 weeks out of every month in agony
Oh my
and
gosh.
popping NSAIDs like they were candy, just
Just to
trying to.
get through the day.
Exactly. And then multiple injuries from just well, now I understand why, but back then I just thought it because I was very active. I was a volleyball player. I was, just running around all of the time, but I would injure myself easily and end up in casts or walking casts from torn ligaments. And so the pain there was kind of chronic. I mean, there's just these layers. And then by the time I was in my teens, I was diagnosed with juvenile rheumatoid arthritis, the pain from what we thought was just the injuries
Oh,
progress. So, I guess I'm bringing that story up in that I don't think I knew what health was, but it was so normalized. My symptoms, it was because there was a pill for that.
right.
So by the time I reached the ripe age of 19, the summer before my 20th birthday, I'm a September baby. And the summer before my 20th birthday, I ended up in and out of the ER multiple times. And everyone just thought it was the continuation of my endometriosis, my IBS, my rheumatoid arthritis. So they just layer cake on another prescription. And one night my roommate came home and found me unconscious and rushed me to the hospital. And it was crazy. Like the whole world changed for me in that moment that I finally had a different doctor who took a deeper look and who absolutely did not treat me like the histrionic, drug-seeking teenager that I'd been treated like up until that moment, and found out, unfortunately, that I was in end-stage ovarian cancer.
Oh my goodness.
Yeah. And so I'm 19 years old. It's 1991. It's a few weeks before my 20th birthday. All of my symptoms, because ovarian cancer is kind of known as the silent cancer, until it's big enough to capture your attention. But because of my collection of diseases prior to that diagnosis, everything was just written off as continuation of those previous conditions. So that's where I was. I was in complete end stage organ failure. I had a grapefruit sized tumor pushing against my ureter, so my kidneys had stopped working. I had metastasis to my liver and all throughout my peritoneal cavity. I had a full fluid belly. I looked like I was pregnant. That's why they kept thinking I was like pregnant or had an ectopic pregnancy from the type of pain I was having. I had what's called ascites, or a fluid that built up in my belly in places where it shouldn't. And I had 100% bowel blockage. So those are just to name a few things that were very much medical emergencies. And the doctors explained to me that I was too sick for even a single treatment of cancer treatment, of chemotherapy. So what happened for me is that message became loud and clear that I didn't expect to fight it or beat it or recover from it or survive it, but I wanted to understand it. And I was a pre-med student, so I had a curious scientific mind. And that's where my journey began, of just trying to understand why a 19, soon to be 20-year-old was experiencing all of these things back in 1991. So that's where it began for me.
Wow.
Yeah.
I can't even believe this. Your whole life, basically unhealthy, pain, taking all kinds of medications, juvenile rheumatoid arthritis, and then 19 years old and stage 4 cancer. I just can't believe it. So what happened then? You were curious, you started learning, but I mean this was pre-internet,
Yes. Pre-Dr. Google,
pre-Dr. Google.
pre-influencers, pre-everyone and their dog has a book on how to treat cancer.
Yeah.
Wasn't
Where
happening
did
back
you
then.
even begin, Nisha?
I love this question. So, again, this is now, it took a couple weeks for them to get the official diagnosis. The official diagnosis rolled in on October 21st, 1991. They didn't expect me to see much into the first of 1992. So, just to give that context, they wanted to make me comfortable, load me up with opiates, and drain the fluid out of my belly as often as needed, which happened multiple times over several months. But because of the bowel obstruction, I couldn't eat. It increased my pain exponentially, and it caused me to vomit. And that was not something I wanted to do, because even the nature of vomiting, the pain that it would cause would elicit throughout my whole pelvic,
Oh,
cavity, was excruciating. I mean, it was just anything to avoid that. And so when they said go home and die was the essence of it, I ended up going to my local, got a second opinion, told the same thing, went to my little local library in a small mountain town. And I didn't know better. I was pre-med. I was hardcore science. I was going to go to medical school. That was my plan. And somehow I landed in the aisle of alternative medicine, which was pretty much a shelf, not even a shelf, like a few books on a shelf in 1991 in little Podunk, Durango, Colorado. And the book that caught my attention, that I pulled off the shelf and sat down and read in about 2 hours, sitting on a sunbeam and a beautiful fall day in Colorado, on the floor of that library, was a book called Quantum Healing by Deepak Chopra.
I know the book.
And so, think about like today, he's a household name.
Hmm.
Not so much in 1991, right? And so, to your point, there was no Dr. Google, there was nothing out there. And really, the only information you'd find about treating cancer was, of course, only standard of care was the option. And about back in 1991, the treatment for my cancer type was incredibly, incredibly aggressive. It's still aggressive today, but not nearly as much as then. And they knew that I would not survive the treatment. But the alternatives, when I looked into that, because something in me was like, well, I might as well look into something. It was, I mean, really, Gerson therapy was about it, right? And then a few things about maybe Laetrile, which was, like an apricot seed. Well, I didn't know where to get that stuff. This was not a time when there was access to this information. I knew nothing about it. But because I was also a scientist, I wanted to understand the mechanism. And
Hmm.
the only understanding of cancer at that time, Jane, was this idea of cancer being and ironically, still today, is cancer is this genetic process, that it was just simply bad luck, that I had just bad genes, and that it's this two-hit theory that somewhere along the way, something else clicked off the genetic malfunctioning in high gear, and that's where we landed, and there was nothing I could do about it. That was the message of the time.
Yeah.
And it
Still for a lot of people, right?
sure
Very good
is.
message.
And so for me, I think in like where did I begin? There were three significant things that happened for me that I look back now. Retrospect is always 2020, right? I think there were three big things that made all the difference that bought me the time to study more, learn more, apply more, right?
Hmm.
And repeat, right? So the first one is I mentioned the bowel blockage. I could not eat. That was probably the best gift I was ever given.
Right.
Because today, I mean, even just from the time of this recording, about 6 weeks ago, a book came out called Fasting Cancer by Dr. Walter Longo, really world renowned in longevity medicine and fasting and cancer and fasting around chemo and other things. Even though this is ancient, fasting in general for health, he's brought the scientific, credential to it of saying this actually is legit. So for me, accidentally, I was fasting. In fact, I did not eat for 2.5 months. And a lot of people hear that and they're like, wait, what? 2.5 months. It took 2.5 months for me to resolve that bowel blockage and for me to dry up the ascites that in the beginning they were draining a few times a week. And then but as more and more I fasted, that ascites came back less and less frequently.
Hmm.
And ironically, ascites is also around a place of real malnourishment, of protein malnourishment. Somehow for me, because I'd been such a sugar burner for so long, I was such a little addict, that my body utilized, like switched gears and started burning another fuel source, which we can go into later, which also stabilized the process. So the fasting definitely bought me time. Also, from literature, which I stumbled upon later from 1909, there was a Dr. Moreschi, Moreschchi, who noted that you could debulk tumors. So basically, make tumors smaller just by fasting alone. So that was likely what happened that helped improve upon my kidney function
Hmm.
because that tumor stopped pressing against my ureter. So it shrunk the tumor enough that I didn't need a stent or anything for my kidneys. So though that was a big deal. Like fasting saved my life. And
Were you getting any nutrients like IV or anything like that? You were just like literally.
yeah, definitely not then. I was able to take tiny sips of water. And weirdly, in my microfiche Dewey Decimal System review
There you
in
go.
my little tiny liberal arts school library, I could find a little bit of information about an herb called Paudarco Tebebwia, which is a South American herb that had had some studies about its use in cell line studies for inducing apoptosis in ovarian cancer cells. So there was a little local herbalist in my town, and I was able to get her to help me find and track down this dry herb. I was able to buy it, like a big, huge bag of it, and basically made tea and was able to sip on that. So warm water and sipping of the Tebebwia, the Pau d'Arco tea, was honestly all I did. And I'm telling you this not to people to go, oh, that's the answer and that's all we need to do. That was just an accident, right? Of just some of the things I found that seemed to be helpful for me. But that was it for months. And then I craved salt. Unfortunately, I wasn't doing the right kind of salt, but I would just like put salt in my water. And so I understand now that I was like looking for those electrolytes and
Right.
things along those lines. But no, that was it. So that was
Wow.
a bit right. Right.
I'm just thinking about your parents in this. Like they were they out of their mind and wondering what to do or like.
Yeah. So Jane, this is where number two, but the other big one. So funny that you mentioned parents. So I don't often tell this part of the story. People know I came. So, in the adverse childhood events research and studies, it shows that
No.
people with more than three adverse childhood events experiences before the age of 18, they have a much higher incidence of chronic illness and cancer at a younger and younger age. And so,
Yeah.
just to give context, I was a 10 out of 10. I actually went to court when I was 14 to get to stop having any visitation with my father. I had to be like I was court appointed, dual custody with my parents. So that was one step. That also then meant that I stepped away from that whole side of my family. That was early on, right? And for reasons we won't go into, but there was a lot of trauma, a lot of trauma in every form you can possibly imagine. It was not that much different at home. And now that I have a much better relationship with my mother and where we are now, there were some other complicating factors with a sibling with a severe mental illness, with extreme poverty, with her own just trying to deal with all of that. Like I can appreciate she was doing the best she could with the information she had. And
Hmm.
also the time of her getting, leaving her marriage and getting divorced was a time then that was really frowned upon, especially by the church and the very conservative community that I grew up in. And so it was like an abandonment on the spiritual front as well. So for me, I had kind of been going it alone for quite a while. And I actually graduated high school and a week later moved away to an entirely different state because I was running away from it all.
Right.
So planting that seed, what ended up happening, lots of other little circumstances, but when I first had that diagnosis, I knew that my diagnosis would be about everybody else and not myself, that everybody else would make it about them. There were a
Huh.
lot of there were a lot of people practicing narcissism in a pretty interesting way and addictions and mental illness in a pretty interesting way that it would almost be like I would be managing them and their response to it. So I kept it very private,
So you
very
made
private,
like a conscious choice to
very
not
conscious.
involve them.
Yep. I even removed at that time we could become unlisted. So I created an unlisted number. And what I tell folks is I went on a 2 year. So I had a 2 month, 2.5 month food fast, but I went on a 2 year family fast.
Wow.
Yeah, that was probably my other saving grace. So yeah, I talked about that. So I had one professor, my roommate, the guy that I started dating, I didn't even tell him for a few months, who's now my husband, and one doctor in my community. That's all who knew of my diagnosis. That was it. So I went, and that's just a bit of my personality. I kind of go it alone, which I'm trying to change in the second half of my life, is that we can go far, we can go fast by ourselves, but we go further together. And so that's been one of my models of creating family and community in a different way and in a healthy way. I did not have to recreate what I came from. I could create something entirely new. So that was number two. Number three is I told you I ended up in the ER and this diagnosis coming in a few weeks before my 20th birthday. On my 20th birthday, I went through a little bit of an F it phase. Let's just call it what it is. Because if they're telling me I'm going to be dead in 3 months, I'm 19. I finally am like getting away from the trauma of my life. And I'm thinking, seriously, universe, this is how it's going to go. I will say that I tried to take my life on two different occasions prior to this diagnosis. And so there was a part of me that was just like, great, this is a way sexier way to go by cancer versus by my own hand. Right. So there was a little bit of relief from that. But this other part was like, life's short, really short, and I'm going to make the best of it. So, long story short, I did an accidental, a bit reckless, extremely high dose, heroic dose is what the scientific terminology would call it, of psilocybin cubensis, psychedelic magic mushrooms.
Hmm.
Was on my night of my 20th birthday. And I did not even talk about that story with basically anybody until after Michael Pollan's book came out just a couple years ago on how to change your mind. I kept that also very private. It wasn't until 2012 that I started talking about my cancer history. And that's a crazy story how that all came about. It wasn't until about 2000, I don't know, probably 2003 that I was really repairing, like 12 years in, repairing some of the relationships with my mom and some of these other pieces. So, just to give your listeners context, like none of this has happened overnight. This is over 3 decades we're talking of the things I've learned. So, really, to recap, fasting from food, fasting from the toxic people in my life, and an extremely accidental overdose of a psilocybin mushroom that changed the way I thought, that changed the way I saw the world, that changed my relationship to God, that changed my relationship to self, and that helped me understand that there was a different way to move forward in life versus the options that I thought I had before that diagnosis.
Do you mind diving in a little bit deeper to that experience, psychedelic experience, right?
Yeah.
What was that like? What was it about that changed you? Did you see it sort of the connection of everything that
Yeah.
that we are more than just this physical body? What was it? What was it about this experience?
So much like I'm even looking at your book behind you, pain free to, to purpose place
Mhm.
here. My pain was I mean, there was clearly physical pain in my life and had been, some different times, but the pain I really endured was very emotional.
Mhm.
And the pain of simply just trying to survive was so overwhelming and so daunting that it seemed to me, and I understand, I mean, I know this is very a difficult conversation to have, and you may have to do a disclaimer when this comes out here, but people who want to unlife themselves, I understand. I do. I understand that place where it seems like the pain is unbearable and that the only option is out. So here's where the interesting research has landed in the space of psychedelics. In fact, in 2011 and 12, I sent about 12 of my patients through the Harvard study on psychedelics for end of life care. Okay. Because what they were finding is that the psychedelics would help people face their mortality. And that they were doing the study, these were all people that were hospice eligible, and they were doing it to help them die well, right? To
So they
face
were at the
die
end of
well.
their life, there's nothing else for them. So,
I will tell you, all but one of those patients that I sent through that are still here today,
oh my gosh, I've got
right?
goosebumps, Nasha.
Right. And so what ended up happening, and I say this because I use their story to reflect it back to mine, is I was so afraid to live that that I was like kind of stuck in this limbo. I didn't want to, like, I tried to take my life, but wasn't successful. Here was the opportunity, but then I also wasn't living. I was stuck in this like hell, like just a hell. And I feel like what the medicines did for me is it broke me through kind of my own internal glass ceiling, and it allowed me to see that there were many other options. And it was like it helped me get up over the fence to go, oh, the grass is actually greener over there. There is something to live for. There is something to hope for. There is purpose from all of this pain. And I just say that, and I have so much emotion right here in my chest right now. Like it's
I
still
got to.
amazing to me, right? Of like, I can't imagine, I cannot imagine feeling the way I felt before this diagnosis and feeling the way I felt before that medicine. It's so hard for me to even think about ever going back there. It forever changed the way I live my life and the way I perceive the world around me. And to your point, this place of it is far is we are there's so much more than just us. It took me out of my very I mean, I will say almost like narcissistic tendency of believing that the whole universe was around me and I was the victim and all it just blew that mother right out of the water and just really gave me a very different perspective on life. And I haven't turned back since.
Wow. Wow. So, so inspiring. And gosh, one of the things that I've really come to understand, and I deep dive into chronic pain, and I know that there's a role that it's all about our emotions and then the body's reaction to it in terms of protection, right? Or that's how I see pain. And I don't know if cancer is protection, but from what I'm hearing from you, there's that emotional component as well. Do you think that, I mean, I know that a lot of cancers are related to toxins as well. Um, how like how much does emotion play into cancers, most cancers, or can you even answer that? Is it that? I mean,
I
not
actually
yes or
can
no.
answer that. It's pretty
Okay.
amazing. There was a man by the name of Dr. Robert Ader, and you've probably run across his work, psychoneuroimmunologist. He
Yep.
coined that terminology. From his work, in the time of my early diagnosis, I ran across his work, and then I ran across the work of Candace Pert, who's
Yeah.
no longer with us. I think she passed away in 2003.
Mhm.
She was doing the molecules of emotion and showing that. The other person's work that I was studying at that time, who would not even have a book come out on this topic until 2011, so 20 years after my diagnosis, I was reading the research and the work of this unknown man by the name of Bruce Lipton.
I've interviewed him.
Right. And so, like, all these people, like, I felt like, talk about angels, people around me of like all these amazing resources landing for me to go another way, a different way, a different way, a different perspective.
Yeah.
So you talk about pain being kind of a messenger, or that's how always have seen cancer. So everyone else in our culture I mean, the way we've even addressed calling it a war on cancer in 1971, the same year of my birth, which we that grew out of a cancer ethos because we were coming out of the world wars, Korean War, Vietnam. So that was a universal collective understanding. So of course we could talk about cancer as like the enemy, something that needed to be battled with. I, for some reason, and probably thanks to mushrooms and other things, I never saw it that way. And I
Mhm.
will tell you, I know people will have their journey with whatever this is, but my experience has been in 30 plus years and tens of thousands of patients directly under my care and hundreds of thousands indirectly under my care. Those who continue the F cancer belief system or the cancer is an enemy and it must be waged, they do not have as good of an outcome as those who understand it as this is a part of me. It's kind of gone rogue. I want to understand why. I want to understand what the message is, and I want to help make sense of it. And I want to try and bring it back into the fold. I want to bring those cells, back into community, into synergy. And that sounds super esoteric and woo-woo, but the research of today is showing us that the tumor microenvironment is incredibly sensitive to the signals we feed it. Sometimes that signal is light, sound, food, water, toxins, chemicals, body care products, industry toxins, but also emotional toxins. And so through the work of folks like the psychoneuroimmunology field, we've been able to understand that even those types of traumas rewire the way our immune system works,
Yeah.
rewire the way our bodies respond to stress, rewire our stress resilience or our stress, responses in a way that makes it work against us or for us, depending on our experiences. So even the work of Dr. Lawrence Lashan, he wrote an amazing book called The Cancer as a Turning Point, unbelievable of the work he started to see that patients who were diagnosed with cancer, you could go back and somewhere between a few months to, 2 years prior to their diagnosis, there was often a kablam, like a big emotional hit. Maybe it
Yeah.
was the loss of a loved one or the loss of a career or a physical injury or some shock to the system that was the precursor. And because I asked this question of everyone, it's pretty significant. And when I really sit with someone and help them understand their own story, I tell you, 9 times out of 10, someone is able to say to me, I know exactly what this is about. I know exactly where this started. And yes, the chemicals and all the things we stew in today on the planet, they're just things that make us vulnerable, but it's the emotional resilience that can sort of make or break your experience around it all.
Gosh, so much similar with chronic pain. The same things that you're saying to the people that keep seeing it as something to fight and something that's awful. And why isn't this ending? They're the ones that don't do as well as the people who see it as a messenger. I mean, I think when things go wrong in our body or what we think is going wrong, it really is just like, hello, I need
Yeah,
your help.
we're here. Exactly. Throw me a life raft. Yeah, yeah,
Yeah.
yeah.
And does require us to embrace it. And I think for cancer, like just with the kinds of treatments like kill it, eradicate it, and beat it, so must be so hard to convince people. And it is the same with chronic pain that, this is something to embrace. It's a part of your body that needs nurturing and caring for. And it's so opposite of what they've learned. How do you convince people that try this?
What's really interesting is one thing I want to be cognizant of and sensitive to for your listeners is that this conversation can be very, very triggering for people because there's a perception, depending on the filter they're using, there'll be a perception that I'm somehow blaming them for their own cancer.
Yeah.
That's not that's not at all what we're doing here.
Mm-hmm.
You don't know what you don't know until you know.
Mm-hmm.
Once you know, you got to do better. It's pretty straightforward, right? And so you can continue to live in or experience the environment that made you sick, internally and externally, or you can choose to change. That's
Exactly.
pretty simple. And so, in that, when I start to help people understand when I start to help them look at the biography that led to their biology, or the chronology or the experiences that have accumulated into sort of the bucket of them, then they have this awareness and a level of self-compassion, which is also often unique because there's also a lot of studies about the type C personality. So cancer has a very particular personality.
Right.
Okay. There's also a lot of information. So, like the type C personality is one who often puts everybody else first.
Yes.
Mhm. And so there's that place of like they're kind of the last on the totem pole. They often tend to be very hard on themselves. And then there's been some interesting studies. We're actually part of a pilot study program that took about 4,000 case stories and did an analysis and a gathering of metrics and data that showed that there's two common emotional patterns that seem to be pretty consistent in about 70% of the patients, which is a pretty good number,
Significant.
which is this idea of not being seen or heard. And if you're accustomed to putting everybody else first, of course you're not seen or heard.
Yeah.
Right. So that makes sense. And so when we start to ask people to like come to this with compassion for themselves instead of like thinking that person's blaming me, because when someone finally does hit their boundary, when they finally get that trigger, it's one usually of anger, and then they want to lash outward or beat themselves up harder. Neither is helpful, right? It's okay to emote, like anger is the will to become. So it's a very powerful tool. I was pissed in the beginning of this process, right? But it actually motivated me. But then I also understood that I misdirected that anger in the beginning, outwardly or on myself, and then worked towards finding compassion to it. And then that seemed to shift things even faster when I had compassion for myself. Oh, you didn't know. It's not your fault.
Mhm.
But now that you do know, you got to do something different. And so approaching it that way is one really helpful way and kind of just educating. And then I always say an educated patient is an empowered patient, and an empowered patient is a very difficult to kill patient. And even researchers out there like Bernie Siegel and others showed the power of community, of support groups, of journaling, all these things that allowed them to like tap into that biography and connect with others and become seen and heard in a way that maybe they have never been. And so cancer becomes an opportunity to learn how to love yourself, which then leads to how you can love others in a more profound way.
I'm just smiling because the similarities are crazy. Like the same kind of people that I see with chronic pain. And I was just talking with someone this morning about what I do, and someone, totally outside. And I said, really, I'm teaching people how to love themselves again.
Gosh, Jane, how beautiful. How
And through that, the body can heal, right? But we can heal if we don't love ourselves. I'm wondering about something else, because one of the big things I see with pain, and I don't know if it's the same with cancer or not, but probably, when people have pain, they have fear.
oh,
Obviously, when people have cancer, they have fear. Shifts the nervous system into dysregulation, but also creates networks in the brain of like a pain fear cycle. Is there a similar mechanism with cancer?
so much. I mean, even down to the mechanism of action of what fear does. You just spoke to the cycle, this kind of vicious cycle. Fear is, I mean, fight or flight, right? It
Yeah.
is a sympathetic nervous system draw to survive. It is what you're running from the saber-toothed tiger, right? But
Mhm.
when you're in that state, you cannot rest, you cannot digest, you cannot repair, you cannot regenerate,
Yeah.
right? You can't poop, you can't sleep, you can't orgasm, you can't connect. Like, right when you're running, you're not like, Bob, let's get together and talk about sports as you're like running from the bear. Like, you're not having like a social interact. You are fending for your life. And
Yeah.
your cells are fending for their life. And so, in that, the physiology is very different. The biochemistry is very different. And so that filters down into these little organelles within each of the cells called the
Mhm.
mitochondria,
Mhm.
which are, I tell people they have three major jobs. Most people just learned in sixth grade that they make ATP, which is our, our
Energy.
factory. And that's a very important role. But really, they're a signal, they're a collector of information, they're a receiver, right? So they take in all that information. So it's scanning the horizon. What's coming at me? I'll take in the good, the bad, the ugly, all the things. Then it translates. Its second job is to translate that information, make sense of it, right? Make sense of it in the context of the environment,
Hmm.
whatever that environment is, good, bad, or ugly. And then the third big job is to then communicate out or signal out into the environment in, on, and around it to do something with that information. So it may tell, it may say things should grow or things should die or things should hide or things should seek, as far as like some immune system, things along those lines. So I'm giving these examples and that you talk about the physiology. I think that they're very similar in the pain place because they keep you in a certain state of reactivity.
Yeah.
It's difficult to break that unless you take very specific steps to create a new environment, a new response to the world in, on, and around you.
You really use the same language as me. I'm always talking about changing the environment. Um, all right, let's talk a little bit because if someone is listening to this, I mean, how many people are touched by cancer? If they don't, it's someone they know, and it's very scary for people. You're identifying a different path. I mean, look at you, you're around, and you've helped thousands of people now as well. Where let's go move on to hope and what people can do. And I know you've got a great book. I've given it as a gift, a metabolic approach to cancer. So let's talk a little bit about that and how you do approach this as a not the conventional way.
Sure, sure. So, the conventional way sees this as a genetic hiccup and sees this as, like sees you as a tumor or a tumor diagnosis, and that's what they focus on, right? That's standard of care. That's its job. And then it approaches it with something known as maximum tolerated dose. So basically, like we're going to hit this as hard as we can and hope that something's still standing at the end of the day, right? And hope that what's standing is the healthier cells versus the cancer cells. Like that is pretty cut and dry oncology as we know it today, what I just described. And that's been the mindset roughly since 1914 when that concept by Dr. Theodore Bovary was first described, the somatic mutation theory. Simultaneously, or within a few years of that, there was another researcher by the name of Otto Warburg who started to say, guys, the genetics are important, but they're a downstream effect
Yeah.
is the cause. And actually, from about 1920 until the 1950s, until we found the DNA helix, Dr. Warburg's theory actually overtook the somatic mutation theory. We really did do all of our research and studies into the damage or the cancer or the chronic illness starts at the level of the mitochondria, which is the protector of the genome. And so we
Wow.
were moving in that direction, and then we flipped it and really put all of our energy since the 1950s back into the gene. Now, a funny thing at the time of this recording, a couple of weeks ago, a new paper came out saying that, guess what? Tides are turning again. The metabolic or mitochondrial theory of cancer is now finally shadowing the mutation theory, the genetic theory of cancer. I'm so grateful for that, right? So, but that also then tells you you've got to think about this differently because if you're napalming a field to kill gene issues or change gene expression, but it's really a mitochondrial problem, and the mitochondria are sensitive to damage in the environment,
Mm-hmm.
the very treatments we do based on this outdated, antiquated theory actually worsens and makes more vulnerable this mitochondrial metabolic pattern. So, just wanting people to understand that why we've not made much of a difference in the past 50, 60 years is because we've been causing just as much damage, if not more damage, to the environment. That, yes, we get lucky and a lot of people miraculously recover. Yes, indeed. But a lot more people don't,
Mm-hmm.
right? And a lot more people are being diagnosed today than ever before. In
Right.
fact, cancer now overshadows cardiovascular disease as the number one killer in Western countries, and 1 in 2 people are expected to meet this diagnosis. So we're doing something wrong because our approach is clearly
Not
not
getting
working.
better.
Exactly. So here's where we begin. When we start to think about this as those three part, the mitochondria taking in information, translating it, and signaling it out, we have to start by assessing what information is being taken in, right? So that's where we start with folks, Jane. Almost everybody will tell me, I was healthy until I got cancer. And every time I hear that, I just feel gobsmacked each time. I'm just always struck. It is literally impossible. So, what I described to all of you about my health history leading up to my cancer diagnosis, I will tell you, I would have been saying the exact same thing. I thought I was healthy because I was head of my volleyball team. I was on, student government. I was, top of my class. I was taking AP, advanced classes. I was a high performer functioning well. The outside world looked at me and thought I was in great shape, that I looked a certain way, that I behaved a certain way, and I had it all together.
Mm-hmm.
I hid all of that. Sometimes we hide it knowingly. I hid it knowingly, but I also had a lot of stuff I hid unknowingly. And many of us are walking around hiding things unknowingly. Like we don't even realize the bad environment that we're in, right? And so, with that, part of the starting point is to understand where you came from and understand where you are and understand what's affecting you. So, we do a questionnaire both in the book, The Metabolic Approach to Cancer, but we can put in the show notes more of a like an elaborated on questionnaire that actually has a weighted score and helps people understand their vulnerabilities. So start by a personal audit, everything you're putting in, on, and around you. What information are your mitochondria taking in? That's where we start. We start by getting curious and exploring our own terrain. Then we make sense of that. Then we start to articulate patterns. And so in my book, I kind of highlight these 10 major patterns that include our epigenetics. So, like basically the family tendencies that were passed down that we can do something about. Our metabolic. So, what are we fueling those cells with? What are we feeding them? Our environmental. You mentioned that. It's like today, living on the planet, it's pretty toxic. So, we have to understand more and take bigger steps to change that. Number four, our microbiome. If you're eating conventionally grown food, you're eating lots of antibiotics. If you're eating grains and legumes, you're eating lots of glyphosate. If you're living off a golf course, you're taking in a lot of glyphosate, which is a massive antibiotic, which is going to disrupt your microbiome and your endocrine system. Then we look at your immune system. Most people are walking around today with very low vitamin D3 levels. Most people are walking around with poor neutrophil to lymphocyte counts. So basically, they're vulnerable in the immune arena, which is the main thing that keeps your cancers at bay and your other chronic illnesses at bay, is this immune surveillance opportunity. I tell
Mm-hmm.
people your system needs to be able to recognize, like, oops, you're not supposed to be here. Respond accordingly, not too much, not too little, and then remember. So if it runs across it again, it knows what to do. Most of us on the planet today are walking around missing at least one of those three R's, if not all of them. And when you miss all of them, it's inevitable that cancer takes place, right? Because it's like a complete loss of the immune response.
Yeah.
Okay. And then we look at inflammation, which is, boy, howdy, that's a big cross pollination. A lot of people, like, our high insulin levels will create inflammation, stress will create inflammation, injury, wrongful diet, toxins will create inflammation. So inflammation is a response to a lot of these things in our bodies as well. And then oxygenation. Most of us are not exercising enough, or maybe exercising too much, both ends of the spectrum. Maybe they've got sleep apnea or issues where they're not perfusing their oxygen levels in the cells. And cancer loves a hypoxic environment, meaning a low oxygen environment. And then hormones. My gosh, we're swimming in a pool of endocrine disruption today. Nobody has deficiencies in hormones. We all have excess, and we all have problems with how we metabolize them. And we all have a different way of metabolizing them. And so some of us store it up in the wrong places, or utilize it differently, or don't recognize it at all. So we need to help the body make sense of the hormonal communication. And then stress circadian rhythm. So if everyone's like staying up at 3 a.m., their body's not repairing. It's also damaging their metabolic health as well. And then the big one is the drops in the bucket of the emotion that we started out our conversation with. If that's not tended to, if all of the tangibles are dealt with, the diet, the lifestyle, the exercise, the cleaning up of the plastics, that's great, right? And super important, and you will make a lot of headway. But if you do not deal with the trauma terrain, you will not change this effectively or for long. You might push it back initially, but it will push back as well.
Yeah.
So that's what we do, is we evaluate their terrain first, help them make sense of their 10 patterns, find maybe what their first two or three priorities are, and then address those in whatever way is necessary. Sometimes it does require a standard of care intervention, but we can support that in a different way.
Mm-hmm.
Sometimes it doesn't require a standard of care intervention. There's a lot of different tools to our disposal. And then the final piece of it is just like reassessing over time. I'm not the same body I was a year ago, 2 years ago, 5 years ago, 10 years ago, 20. What worked for me at 19 does not work for me today. I have to keep checking my own data points, my own metrics, and pivot, and know what works well for me, what environment I'm in, what stage of life am I in. So these are the things that we help people understand, and for them to continue to move forward with a curious mind and a collaborative approach to say, I don't have all the answers, but I
Mhm.
can help you determine where you are in this moment and what are the best tools to take you the next step forward.
Wonder how hard it is, and I'm sure you're going to answer this, but often when people hear cancer and they get a diagnosis of cancer, they feel like they're, in a race with time.
Yes.
And I felt like that with, I'd hear that with rheumatoid arthritis, which was my diagnosis. Like, you got to get this under control, or you're gonna, your joints are gonna be permanently damaged, and hear all that. So I felt like I was in a race against time. Now, cancer is even scarier for people. How do you help people like calm down so that they can, because it's a slower approach, right? It's not that what, like really drive it hard. It's a slower approach, I think, right? So how do you help people understand that they have more time?
Well, first of all, I love this question because really, even Lawrence Lashan said that it's super rare that the actual diagnosis of cancer is a medical emergency. Now, my situation back in 1991, it was.
Kind of
I had
was.
organ failure. I had a blocked, colon. I mean, I had a lot of things pressing against some valuable real estate. That is a medical emergency. But most of us find out we have cancer and it's like an incidental finding of some really low grade symptom or some weird finding on a lab that takes us further, or some, hey, I went in for my routine physical and this was found, or hey, I was hanging out with the influencers or the biohackers and did a early imaging and found I had, something going on, or, so it's most of the time I want people to understand, probably well over 98% of the time, it's not a medical emergency.
Okay.
And I also want people to understand that most of the time, I would say this has changed a little bit in the last few years, and that's a whole nother ball of yarn we could go down. But up until a few years ago, most cancers would be on board for an average of 7 to 10 years before it was big enough and loud enough to capture your attention. Meaning that you're talking about time not being on your side. This has had a lot of time to do
Mhm.
its thing. And so rushing into something, I will tell you, is often the biggest mistake people make. I want information before you move forward. I want to know how best, first, I want to know the personality of your tumor, but mostly the personality of your terrain, right? And I
Mhm.
want to build you up for meeting whatever treatment you face. So, for instance, a lot of people don't understand like radiation, if you have high insulin levels, your cancer cells are desensitized to the radiation. So it doesn't work as well, and it leads to higher mutation status, and it relates to higher recurrence and progression. So, wouldn't it be nice to spend a couple of days or a couple of weeks getting that person more metabolically flexible, getting teaching them how to be in a fasted state at the time of their radiation, teach them to go in, fasted for the radiation, taking a little bump of exogenous ketones, potentizing the radiation by doing a little oxygen therapy right before they went in, or even just a quick exercise like some jumping jacks to bring some oxygen because cancer walls off to that radiation. Radiation has a hard time getting to hypoxic tissue. So if you can bring some blood flow and oxygen to it, you get that radiation to where it's supposed to go, not to your healthy tissue. And then you can sensitize radiation with things like high dose melatonin that also then is protective to the healthy tissue. Now that's not quote unquote alternative. That's called making standard of care work better for you.
Right.
So if we pause, we take in some information. First, we run some baseline tests. So we actually have metrics to test for both during, like before, during, and after treatment. Then we also have something to just watch. Instead of someone just say, watch and wait. No, we're watching and being assertive, right? And we're getting information and we're knowing what's working and what's not working. Because a lot of patients, unfortunately, they'll say, hey, the tumor's still here at 3 months in, we'll just do more of the same. Well, that's not the time to do more of the same. If it didn't respond quickly in the beginning to those cytotoxic standard of care therapies, it's never going to respond. More is rarely going to fix it. It will kill you. The treatment can kill you. So how about we take a pause? We study the actual tumor itself through some, better testing to understand the personality of the tumor, and we support the treatments, whatever's best fit to that tumor, then we have a different outcome. Then these patients are far more successful with far less side effects, far less rates of recurrence or progression. And suddenly we take something that was considered a death sentence and make it into a manageable disease process that can often go completely into remission. So if you're a stage 1 or 2, getting into remission and keeping that is very easy with an integrative approach. A stage 3 and 4 is more of a lifelong journey now, right? And so this new way of being is met differently. You have a different awareness of yourself. And all those people who ring the bell at the end of their treatment, of their chemo or their radiation, that is often signifies in standard of care the end of treatment. I'm wanting your listeners to understand that's actually the beginning of treatment.
Mm-hmm.
That's actually where my work starts. Now, I would prefer to get you all before you even start standard of care treatment so I can get you ready for it, get you through it more elegantly with less side effects and a better quality of life, and then help you understand throughout the process as to the why of your cancer so that you know how to keep it from coming back again, which it will in 70% of cases. So now we have a different framework, one of empowerment, one that says, okay, I'm going to meet this head on, but I'm going to bring in all the tools to support me while they're being standard of care are targeting my tumor. I am your terrain expert. They are not. I'm also a tumor expert because I had to learn that too. But they're tumor experts, right? Let them be the tumor experts, but bring on your team to be your terrain expert, and your outcomes will be very different.
I love the message of empowerment, Nasha, that it's really switching people because that other care, they're very much, like just receding, tell me what I got to do. But you're putting them in a position of empowerment, of being proactive in their life, and also making the changes so that that environment where the cancer began is you're changing that environment, so you're making an environment where that's not going to happen, or hopefully not happen. So I really love this. You've got the great book, A Metabolic Approach to Cancer. And you also, I know you work with people. Do you only work with people in person, or do you also work with people online? How does that work?
So I actually no longer see patients. I've not seen patients since about.
Okay.
What I do, however, is I train clinicians around the globe. And to date, we've got almost 1,000 healthcare providers and allied health professionals in 46 countries who've come through my training program. And we matriculate 2 of those courses for doctors a year, 2 of those courses for allied health professionals, such as nurses, occupational therapists, nutritionists, and then 2 of those courses a year for advocates. So patients who have a general curiosity, maybe themselves have come through this cancer, worked with me or somebody who have trained through this process and want to give back and are really passionate and become a good ally for the patient on this journey. So we're doing 6 courses a year for all these folks, and that has been going on since January of 2020, and it just continues to explode. So for me, on our directory, mtih.org or metabolicregen.com or drnasha.com, there's a directory there that shows the people who've come through our training. Now that directory is getting like, it ebbs and flows because when doctors are full up and they have a long wait list, they may pull themselves off the directory for a while until they can open up to new patients again. But just to give your listeners an opportunity to hear this, we get about 30,000 inquiries a month on our directories. So
People are
fact
looking for different answers.
are looking for a different answer, and we don't have enough people to meet that need. And so I am like, we don't need to have we have to have an education program. We don't need to. This isn't a business venture. This is a public demand and need venture. And so my hope is that, I know that we'll need to scrape the surface. We will need 20,000 physicians. We will need 40,000 allied health professionals, and we will need 60,000 advocates to actually make a dent in the cancer crisis globally.
Wow.
We have a
I
long ways to go.
I love your mission. I love your mission. And also that instead of you seeing, all this knowledge that you learn, instead of you just working with patients one-on-one, you're now training and having such a big ripple effect out in the world. And I'm just talking to the audience now, if you are a physician or an allied health professional, and this is sparking an interest in you, check out the program. The world needs you. More people. We need more people too.
Thanks.
Help
Yes.
help people understand. Help people understand how to heal from this, how to live with it and live long, healthy lives.
Well, Jane, it gives me such hope that even what you teach is so similar to what I teach, that it's just like, okay, it may be that yours is like pain is the label, mine may be cancer, but we have colleagues that like thyroid might be the label or mental health might be the label. There is this particular sort of lens to come through of the terrain. And I think
Mhm.
that that's something that's really resonant is like understand this beautiful ecosystem that is you and how it interacts with the ecosystems in, on, and around you. And that if you start to make an improvement there, you make yourself resilient for all things, all things.
Exactly. Exactly. Dr. Nasha, what would you say is one baby step someone could take today that's going to make that shift towards that, environment in and around us that's going to begin to initiate healing or just support the body's natural healing ability? What would you say that one baby step would be?
Gosh, I would just say get curious. Know that you're far more powerful than you've led to believe. And also, unfortunately, the world around you is not going to do it for you. You're going to have to take some personal responsibility to educate yourself. So, the book is a good resource for that. It's a good way to make yourself aware, like the questionnaire that's on in the book itself is a good starting point. The one we'll link for you as an even deeper dive that helps you go, okay, I didn't realize how much plastics were affecting my life, or how much my sleep hygiene was impacted, or how much my diet was really playing a role here. Get clear on your blind spots, right? That's really important. And then know that in each of the chapters, based on your priority, it gives you tangible things to do. Like it's an empowerment tool, if anything, an education tool or an empowerment tool. But then you work with people like Jane and others who understand the importance of supporting the whole organism, and continuing that journey of curiosity and exploration and self-care and self-awareness.
Beautifully said. Beautifully said. So you mentioned a couple of websites earlier. How can people follow you and the work that you're doing?
Probably the simplest place would be to go to drnasha.com, drnasha.com. It will link you into a lot of places. It'll link you into the books, Metabolic Approach to Cancer and Mistletoe and the Emerging Future of Integrative Oncology book. It will link you to all the other podcasts that I've been a guest of, including Jane's eventually will be on there. It will also link you to my podcast, Metabolic Matters. Someday Jane and I will have a conversation there as well, I'm sure, sooner than later. It will also take you into our nonprofit endeavors, which is taking us into the realm of research, also data collection in this place and publication, as well as patient grants to get access to this type of care. So it will kind of show you the range of things that we're involved in trying to change the narrative of cancer and trying to educate and empower the masses to not be a statistic.
Oh, I love it. I love the work that you're doing in the world. You're making such a difference, Nasha. Just thank you. Thank you so much for all that. I'm sorry you had to go through the journey you did, but you know what? I do believe that there's a purpose in things, and this was awakening you to your purpose. So
Oh,
it's
so
been,
very much.
it's a beautiful journey. Thank you so much.
And
Thank you.
thank you to all of your amazing community for being a fly on the wall for our conversation today.
It's been a wonderful conversation. So thanks everyone for watching and listening. And I know you know someone that needs to hear this. So please share this interview with them, give them hope, give them empowerment, and you can change their lives. So thanks again, Dr. Nasha. We'll see you all again soon.